Oh, I see Sharon signing. So apparently you can hear me. Good deal. Thank you, Sharon. Good to see you. Thank you for joining us today. Well, folks, obviously we are doing this a little different, as Taylor had mentioned. On Sunday evening, we had three friends over for dinner. We did it outside, but one of the folks who came over for dinner since has tested positive. And so Suzanne and I are now quarantining for the next 14 days. So officially it would start Sunday evening as the quarantine period and run through November 22nd. So we're, like many people across this country, going to adapt to the new world we're in and do things virtually. And so I will continue to be working and doing these press conferences. So we'll still continue to plan on doing these. They'll just be, as Taylor said, done a little differently here, featuring the Zoom software and me on the TV. So to kick things off, though, again, we always want to remind people, again, of course, me quarantining is a great reminder that we still have the virus in our community. We still have a pandemic going on. And so using all the tools that we have with regard to, when you go out in public, keeping that 6 foot of distance between you and other people, wearing a mask when you go to the store, washing your hands often. We also have talked about avoiding the 3 C's, crowded places, confined spaces, and close contact. Those are all great things that we should be doing. Stay home when you're sick, have good ventilation in the rooms that you're going to be in. These are all tools that we have to be able to slow the spread of the virus here in Nebraska. And obviously, quarantining is one of the things we ask people to do once they've had that exposure. And so that's another way that we have people slow the spread of the virus. So we want to encourage people that if you have had that close contact, please quarantine to be able to slow the spread of the virus. Now, on that topic, one of the things that we want to highlight is that when you are quarantining, again, you typically are waiting to see if you've got the virus, which means you have to have a few days where the virus could be incubating in you and not be able to be detected by testing. And so typically you've got to wait 3 or 4 days at the earliest before you would be able to test to see if you've got the virus. And again, just a reminder, you can't test out of quarantining. It's just to see if you have, if you develop symptoms, then obviously you should get tested. But if you're asymptomatic, you need to wait at least 3 or 4 days to determine whether or not you've got the virus. And that's what, the First Lady and I will be doing is waiting to get tested at some point down the road. Because again, after an early exposure, you're not likely to be able to have that detected from the testing that we've got going on. But it's also a reminder that we have Test Nebraska open. We've been able to issue back about almost 400,000 tests through Test Nebraska. And the current turnaround time in getting a test back is about 24 to 36 hours. I know some people have even received their results back more quickly than that. The last time I went through Test Nebraska was about 27 hours for me to get my test results back. So again, a great option to be able to help us slow the spread of virus here in our state is Test Nebraska. Now, all of that are tools that we use to slow down the spread of the virus is about making sure that we maintain our hospital capacity here in the state of Nebraska. And right now we're looking at a hospital bed capacity of about 31% of our hospital beds, about 29% of our ICU beds, and 74% of our ventilators are available. And so we want to continue to maintain that robust capacity. Now, one of the things that we've been working on with the hospital system is to be able to make sure that they've got the resources to be able to take care of the people. We have seen an increase in the number of hospitalizations. On September 23rd, there was about 200 people in the hospital. And as of last night, there's about 820. So a significant increase in the number of hospitalizations. One of the things we've done at the state to be able to help with that is we directed $40 million of our CARES Act money towards hospitals to be able to do things such as hiring traveling nurses or additional staff with regard to respiratory therapists or screeners at hospitals, pay hazard pay to current staff and so forth. Another thing that we have done is work to be able to help provide more additional staff by getting people trained. And that's one of the things that Dr. Gary Antone, our Chief Medical Officer, as well as the Director for Public Health here in the state of Nebraska, is here to talk about is some of the programs we have to be able to increase the amount of staffing that we've got here in our state. So with that, Dr. Antone, you want to come up and talk about our Center for Nursing and some of the programs you got there to be able to help increase the capacity that we have here in the state.
So thanks, Governor. As everyone knows, our healthcare professionals, our healthcare workers across the state are working tirelessly, since this all began back in March. And I've witnessed this personally, and initially it was more of a physical fatigue. And now I'm seeing and hearing more about more of a mental fatigue. In either case, it's becoming very hard on our healthcare professionals, but they're doing a fantastic job, and I want to thank every one of them for their efforts. So we know, and we announced last week, and Governor just mentioned, we have seen quite a bit of an increase in our hospitalizations, which is stressing our healthcare workforce. As the Governor mentioned, a couple of weeks ago, we allocated $40 million through CARES Act funding to the hospitals across the state to hire traveling nurses and to offer hazard pay to their existing staff to pick up either overtime or extra shifts. And from what I'm hearing from the hospitals and the CMOs and the CEOs is that this has been successful for them. This additional funding has really added to their capacity to increase their beds by staffing those beds. But today I'd like to highlight another Nebraska resource that we have that's been developed to help with the staffing of our hospitals as well as long-term care facilities. It's an online resource that can connect nursing assistants and nurses to employment or volunteer opportunities within these Nebraska facilities that have critical staffing needs. The Department of Health and Human Services has worked with the Nebraska Assembly of Nursing Deans and Directors, which represents deans and directors from 17 different schools of nursing across the state. We also have been working with the representatives from Leading Age Nebraska and the Nebraska Healthcare Association in collaboration with the Nebraska Center of Nursing, and they've created a special section on the Center for Nursing website for COVID-19 staffing resources. I want to thank Teresa Delahoyd from the deans, nursing deans and directors for helping and assisting with this. This resource provides now a central location where nursing assistants and any registered nurses can find information on opportunities to provide assistance during this pandemic. So any qualified nursing assistant or RN or any form of nurse can go on this website, Nebraska Center for Nursing, and the website is Center for Nursing, all one word, .nebraska.gov, and then navigate to the COVID-19 Resources section tab, where they will find a list of employment opportunities. And in addition, nursing students during this time of their winter recess break can also take advantage of this opportunity. So all the employed facilities or facilities that are taking part of this will provide orientation and training of any new hires. So currently, visitors to the site will see what openings are available at the hospitals or long-term care facilities, and we want to add more facilities, specifically hospitals, to this list. So any facility that's not on the list at this time but wants to be added to this resource can get a hold of Ann Ortwick at our Department of Health and Human Services at 402-471-0317 or via her email at ann.ortwich, OERTWICH, at nebraska.gov. Again, I thank everyone in this effort for this opportunity. It's something that I think is going to also add to our existing staffing needs. So at this time, I'm going to turn it over to Ashley Newmeyer, who the Governor mentioned is our Chief Data Strategist at the Department of Health and Human Services. Thank you.
Thank you, Dr. Antone. Thank you, Governor, for the opportunity to provide an update on the work of the DHHS contact tracers. So just as a reminder, contact tracing is an important tool to slow the spread of COVID-19. Contact tracing starts with a positive test result that's reported to the state or local health department. Next, a trained contact tracer will call the person who received the positive test result and ask them a series of questions about the symptoms they may be experiencing, if they know when and where they were exposed, as well as who they were in close contact with during those first few days prior to their symptom onset or positive test. The graph to my right is what I want to highlight today. So this graph depicts the number of COVID-19 cases that DHHS contact tracers handled on behalf of the local health departments over an 8-week period starting September 6th through October 31st. Again, a case means a positive test result was reported to DHHS. The graph only depicts actual case interviews conducted on positive cases. So over this 8-week period, starting September 6th, the number of cases handled by DHHS contact tracers increased nearly 4 times. The green shaded part of the bar represents the percentage of cases for that week where DHHS contact tracers completed the case interview within 24 hours of the positive test being reported to us. The blue section represents the percentage of cases for that week where DHHS contact tracers completed the case interview within 25 to 48 hours of the positive test being reported. The orange section shows the percentage of cases that were completed within 49 to 72 hours of the positive test result being reported. And finally, the red section represents the percentage of cases for that week where DHHS contact tracers completed the case interview in more than 72 hours. To reiterate, this graph does not represent all of the cases reported during this 8-week time period, only those positive cases where DHHS conducted the contact tracing interview on the positive case. So you can see that the week of September 6th, so the bar on the far right, there were 82% of the 750 case interviews handled by DHHS that were completed within 48 hours of the positive test result being reported. The week ending October 31st, so the final bar on the left, 85% of the case interviews were completed within 48 hours of the positive test result being reported. This is also nearly 4 times the cases handled compared to the week of September 6th. Our goal is to complete 90% of case interviews within 48 hours of receiving a positive test result. This graph does not represent all of the case interviews conducted during each of those weeks, only those worked by DHHS. Many case interviews are also conducted at the local health department level. To reiterate, contact tracing is an important tool to slow the spread of COVID-19. If you receive a call from your local health department or a Lincoln number, it is important to answer. In order to improve the timeliness of contact tracing those who are positive, the DHHS contact tracers call those persons every 2 to 3 hours until they are able to speak to them. DHHS has a number of contact tracers who are bilingual in Spanish and Vietnamese as well as other languages. Completing your confidential interview with a contact tracer is one of the best ways that Nebraskans can help protect our hospital capacity and slow the transmission of COVID-19. Back to you, Governor.
Great, thank you very much, Ashley. Okay, am I off mute now? Sharon's moving her hand, so am I off mute?
Yes, you are.
Yeah, okay, good. Thanks, Sharon. All right, very good. So thank you very much, Ashley. And a couple things along those lines. Our local public health departments are really the first line of defense when it comes to doing that contact tracing. The resources that we have in the state are really to supplement their work and are on call to be able to help them out as they're needed by those local public health departments. I believe Douglas County, for example, uses a lot of our contact tracers that we have at the state level. I'd also like to reiterate what Ashley said with regard to when people call you, please pick up the phone and talk to them. Again, this is important for us to be able to help educate people who may have been tested positive or were close contacts of people who are tested positive. And then, just in general with all of our folks here, whether it's at the state level or our local public health departments, please remember they've got tough jobs making these phone calls, talking to people. A lot of people are obviously not pleased when they find out they've tested positive, and just allow a little space for grace, please. Please treat them with dignity and respect. If they make that phone call to you, they're just trying to do their jobs. They're just trying to keep us all healthy. So please respond back with grace and let them know about your situation. And again, please pick up that phone call because that's one of the ways that we really help limit the spread of the virus. The testing and contact tracing is really the blocking and tackling of how you manage any pandemic. And so it's very important that we are able to reach out to the folks who've tested positive and for those folks who may be close contacts so that they can quarantine like the First Lady and I are doing right now. All right. Well, again, thank you very much, Ashley. I appreciate you going over that data with us. Next, we'd like to go over the CARES Act funding. The state of Nebraska has received about $10 billion from the federal government in relief since the beginning of the pandemic. 1.084 billion of that has come directly to the state through the CARES Act. One of the things we've done at the state is we've created a variety of different funds to be able to help out organizations as they go through this pandemic. And on October 19th, we had announced some additional CARES Act programs to help people out. The grant applications that remain opening are the following. At the Department of Economic Development, we still have our grant programs for hotels and convention centers, event centers and arenas, and movie theaters. At the Department of Health and Human Services, we still have our stabilization grants for charitable organizations and licensed providers. So eligible organizations are charitable organizations tax exempt under 501c3. We of the Internal Revenue Code, state of Nebraska licensed facilities. For example, hospice services, rural health clinics, assisted living facilities, child placement, and so forth. And community-based developmental disability agencies certified by the state of Nebraska, Department of Health and Human Services are also eligible. So the eligible expenses include, but are not limited to those that incurred since March 13th for normal business operations, such as rent, utilities, and payroll. Now, the following programs have been fully subscribed and are now closed and no longer accepting applications. And those are the programs in DED for Small Business Stabilization Program, the Livestock Producer Program, Restaurants and Bar Stabilization Program, Licensed Personal Service Business Stabilization Program, and in the Department of Health and Human Services, the Health Places Grant for Centers of Worship. Again, if you're looking to apply to these grants, you need, please go to coronavirus.nebraska.gov. That's coronavirus.nebraska.gov. And you can also call 1-833-500-8810 between 7 a.m. and 7 p.m. Central Time. Again, that number is 833-500-8810. And that's Monday through Friday, those times, those Central Times. Again, we're obviously doing things a little bit different, but we will have another press briefing on Thursday at 2 p.m. And tomorrow is when our directed health measures begin at 12:01 a.m. And will run through November 30th. It is also Veterans Day. And so I'd like to thank all of our veterans across the state of Nebraska for your service to our great nation. We have our freedoms here in our country because of our veterans, and they sacrifice a lot to keep us safe and to protect our liberty. And they give up, time with their friends and families. And of course, we have many of our patriots have given their lives in defense of this nation. So we want to take the opportunity tomorrow to remember our veterans. If you see a veteran, please reach out and thank them. Obviously, because of the pandemic, some of the typical things we would do for our veterans are not available. But I encourage people to find innovative ways to be able to say thank you to our veterans who have done so much for this country. All right. Let's see. Next, I will go ahead and we'll get into the Q&A, unless, Taylor, you interrupt me and tell me that I've missed something here. So we've got a variety of questions here. Andrew Mim from KGFW. Has anyone explored the possibility that our surge may be actually caused by people who are wearing masks and not who don't social distance? Nobody has done any studies along those lines that I have seen. I would remind folks that the mask is one of our tools, that we also have that 6 foot of distance we talk about, the washing your hands, the staying home when you're sick, avoid the 3 C's. These are all tools that we have to be able to help slow the spread of virus here in our state. And please continue to leverage those as we go through this pandemic. Did Governor Ricketts have communication, and this is also from Andrew Mim, did Governor Ricketts have communication with projected President-elect Joe Biden or a member of his team prior to drawing up the new restrictions? And if so, what was the substance of that discussion? And the answer to that is no. We've had no communication from that direction at all. So we made this in conjunction with our conversations with our local public health directors, the team at the public health at the state of Nebraska, and other advisors with regard to those restrictions. And so it really just folks within the state here. Don Walton from the Lincoln Journal-Star asked, can you tell me if restaurants and bars can expect any further pandemic assistance? We get calls from some who say they can't last without some help. And as I mentioned, the restaurant bar program, our second program for restaurants and bars, the first one was covered under the small business program that we had earlier in the year. The second one, we set aside $20 million just for restaurants and bars, has been fully subscribed. We don't have any additional plans at this time. So we'll just have to continue to work through this issue and see what happens with regard to any additional federal programs or and so forth. Okay, Joanne Young, Lincoln Journal-Star. Was the dinner at a private residence or a restaurant? And it was at my private residence in Omaha. And Joanne also asked, would you characterize this as letting his guard down? And I would say, no, I don't believe it was letting our guard down. We had the dinner outside because we knew it'd be the last time we'd be able to do something like this with the nice weather, at least likely the nice weather, at least before the end of the year, so that we would have good ventilation. And guests wore masks as they came into the house and so forth. But I think it does demonstrate that we just all need to be careful with regard to social interactions and try and keep them to small group gatherings. Because the virus has, spreads from person to person. So we'll always take the opportunity to do that if it can. So make a statement to enforce this care people need to take. Yeah, so absolutely. We all need to take care and to remember this is a virus. It spreads from person to person. And so we all need to take care. And what did I mean by saying it get tested at the appropriate time? Just kind of what I was talking about. That was a statement from our press release. And that just gets to, again, once you've been exposed, you typically need the virus if you've got the virus, it's going to need 3 or 4 days before it incubates enough for it to be picked up by testing. So it doesn't do you any good if you've been exposed on one day and go test the next day. It's not likely to be able to pick that up and may give you a false sense of security if that test comes back negative. So you really do need to wait at least those 3 or 4 days before you get tested. And again, just remember, you can't test out of quarantine. Joe Jordan, News Channel, Nebraska. On the one hand, the governor has required masks in certain settings. On the other hand, he says he's not issuing a statewide mask mandate. How is the requirement to wear a mask not a mandate? Well, again, we're requiring masks in specific situations where you've got staff and patrons who are closer than 6 feet for longer than 15 minutes. Again, that fits in with our general guidelines and rules about wearing a mask when you can't avoid that close contact. And so it really is giving the force of law with regard to those businesses, the wearing the mask to be able to make sure everybody's staying healthy between those patrons and that staff. Lee Waldman, WWT. Governor, are you advising people who took the pictures with you after your press conference yesterday to quarantine since no one was wearing a mask? So again, the quarantine rules, you quarantine when you've had that close contact with somebody who is tested positive. That really is not the situation that we had yesterday. And then, are you going to reconsider maskless group pictures in the future? And again, when I take pictures with groups, typically what's happening is, if we're inside, we're taking our masks off to do the picture. You probably have noticed there's a number of pictures where we leave our masks on when we take those pictures. But whatever, we typically are doing that. If we do take the masks off, we're doing it for a very short period of time just to take the picture and not staying in close contact for that 15 minutes or more. Okay. The next question comes from Martha Stott at the Omaha World Herald. Again, this just gets back to what I said before. The release says Governor Ricketts and the First Lady will get tested at the appropriate time. Again, just gets back to you need to give the virus a chance to incubate so it would be able to pick up. If you get tested too soon and you come back negative, it may give you a false sense of security because you may still have the virus. It just isn't able to be picked up by the testing until at least 3 or 4 days down the road. Jerry Elster, WNAX. South Dakota voters approved the sale and use of recreational and medicinal marijuana starting next July. What is the state's response to that, and what should the border counties prepare for? Well, we've certainly seen in other states like Colorado, when you pass legalization of recreational as well as medicinal marijuana, that you see an increase in traffic fatalities that are caused by marijuana. You see an increase in a number of other things, such as young people getting a hold of the marijuana. The marijuana has the opportunity to create psychosis in people, and that can lead to a number of very bad outcomes as well. So those bad health effects happen when you legalize marijuana. And so I would expect that South Dakota is probably going to see the same sort of statistics that we see in other states that have done that. With regard to the border counties, we will probably see the same sort of thing that we saw with our counties that border Colorado, which is an increased number of people who are trying to illegally traffic marijuana across our state border lines and being picked up and put in jail for that. So that is probably one of the increased costs that we will see here in Nebraska with regard to legalization of marijuana in those other states. Ruda Al-Sanate asks, how often is the governor being tested? When was he tested last? Results of the test. So over the last few weeks, typically I've been getting tested about once a week, and the last test I had was on Wednesday, and it came back negative. Andrew Zaki. We are, well, actually, I think we addressed this with Andrew. Just with regard to Test Nebraska, getting in and be able to do it. I know that, for example, my wife went on today to schedule an appointment and scheduled one for later in the week. So sometimes test slots do fill up. We typically, though, getting those test results back in 24 to 36 hours. So we've dramatically improved upon the time to get those test results back. And obviously, there's different locations you can try. Certainly in the Omaha area, there's multiple. Another viewer said DHHS recommended a third-party website to go to. That is not happening on our Test Nebraska test line. People don't recommend other folks there, though there are other commercial providers that are charging to be able to do those tests. At Test Nebraska, again, it's free. You can sign up at testnebraska.com, and as soon as you just complete the assessment, anybody who completes that assessment is then eligible to start scheduling a test. And Taylor, I see you've approached the podium, so maybe you've got some additional questions.
We do have some additional ones that have been sent in. Michael Shively is asking, he says there are counties that have issued a mask mandate for their courthouses with virus numbers rising. Do you still plan to withhold federal coronavirus dollars from those counties, or are you reconsidering that decision?
Well, I have not heard of any counties who have issued a mask mandate for their courthouses. So we'll have to investigate that and then get back to you on that.
Andrew Azaki also has a couple more questions. He asks, is Thursday the earliest time you can get a Test Nebraska test? And do we know what the average time is running before you can take a test now? And are we going to increase testing sites?
So with regard to that, again, as I said, my wife went on to go get a test. She was offered testing schedules on Thursday and Friday. So again, I imagine it's just that's in the Omaha area. So I don't know what the test availability in Lincoln would be. Again, what I encourage, though, is go on and look for the next available time to get tested. And then if you're closer to multiple locations, you can check multiple locations. Now, I'm sorry, what was the, and then just whether or not we're looking at expanding testing. Again, we don't have any current plans to expand testing, though, again, we constantly look for ways to be able to do a better job and service people better. So, for example, one of the things that we've done is we've contracted with a Nebraska-based company to be able to create some protected shelters to do testing. And we've actually set the first one of those up in North Omaha. And we'll be looking to expand that as well as the weather continues to grow colder.
Ruda from KMTV wants to know, what type of testing are you undergoing? Is it rapid or testing through Test Nebraska?
So I've been going to testnebraska.com.
Julie Anderson from the World Herald wants to know, with all these new cases, is there a backup in scheduling appointments with Test Nebraska? And she had a similar question to Andrew, is Thursday the earliest?
So again, I can just tell you the experience that my wife had was when she went online today, she was offered spots on Thursday. So, but again, that's going to be variable depending upon the demand that we have. And, we're going to continue to look at, ways that we can increase the process time to be able to get that done faster. We've been, for example, a lab bringing in new equipment, making sure we've got the appropriate staffing. That's one of the ways we've been able to get those test results turned around in 24 to 36 hours.
And then finally, Julie wants to know, what are the results of contact tracing, or what are the main drivers of exposure here?
So actually, I'm going to have Ashley come up here as well. But typically, when we've looked at this, we haven't seen one big, huge driver. In fact, talking to local public health directors, a lot of it has been informal gatherings. Though, really, when you go out in public, there's always going to be that opportunity for a variety of things. Ashley, do you have some specifics, though, that you can share with Julie?
So Governor, I would say that, again, the local health departments do share some anecdotal information around the case investigations that they're conducting. It has been kind of informal, small gatherings. We occasionally will hear about, potentially a wedding event, or sometimes it's people getting together for coffee. So I think the important point here is that sometimes it's hard to know, so we always need to take precautions and socially distance and wear masks when you're within 6 feet for 15 minutes.
Yeah, and maybe if I could just piggy back on that for a second, and Ashley, feel free to jump in. In our conversations, like with Dr. Adipur in Omaha, very few of the cases have been transmissions within schools. That schools are doing a fantastic job of having kids wear masks, spacing them out in the classroom, washing their hands often, which grade school kids especially, even high school kids may not be doing that often. So I think one of the things we've seen there, and then certainly some of the events that the schools sponsor are very well structured as well. It's really some of the informal type events. For example, one of the cases that just was brought up as an anecdotal case was of a slumber party, where you had a number of individuals go to an event and then do a slumber party. And again, if you're going to have a slumber party, I presume that's going to the individuals are going to be in close contact, probably not with great ventilation. And so that was a case where a significant number of those individuals ended up testing positive for coronavirus. So, that's an example of like some of the activities that we recommend against, is when you're going to be extended periods of time with a close group of people that you don't have the opportunity to be 6 foot away, to wear a mask, to have good ventilation, that sort of thing.
Then we do have another question for you, Ashley. Martha wants to know how many contact tracers does the state have now? Are all the people who helped out earlier still doing it? You'll want to repeat the question into the microphone.
Okay. So Martha Stoddard had a question about the number of contact tracers that DHHS has currently, and what was the second part? I'm sorry.
Are all the people who helped out earlier still doing it?
And are all of the people who helped out earlier still doing the contact tracing? So I do have the numbers here scheduled. So for our current week here, so the week of ending November 16th, we have over 1,000 contact tracers scheduled to provide contact tracing assistance. Some of the DHHS public health staff that we had pulled in as reserves are not currently scheduled, but they still are trained up and ready to assist if we need to. We have been increasing our numbers of contact tracers week over week, really since November, as you can see with the increase, or I'm sorry, not since November, since September. As you can see on the chart with the increasing cases that we were taking on, we were pulling in those assistance from the PRC and NELNET call center, as well as our DHHS teams were ramping up the scheduled hours that we were providing to assist with that contact tracing.
And then we'll go to questions from here in the room, and I'll just call on people since the governor's camera is facing this direction. So Fred, you want to go first?
Governor, how are you feeling? One more time.
You want to just raise your voice a little bit? The microphone's right there. Yep.
Governor, how are you feeling? Do you have any symptoms?
I'm sorry, I'm still not able to hear Fred.
So Fred's question is, how are you feeling? Do you have any symptoms?
I am feeling great, and I have no symptoms. Got on my bike today and did over 23 miles on my Peloton.
Well, is that a stationary bike or is he out?
Is your bike a stationary bike?
It is a stationary bike, yes, Peloton.
And then Brandon Axman with New Channel, Nebraska has a question.
I think I know from his answer he just gave, but is he quarantining in Omaha or Lincoln?
Brandon would like to know if we're quarantining in Lincoln or Omaha.
So I think actually for security purposes, we're not supposed to be divulging where my location is. So we're going to decline on that one, thanks.
Question for Dr. Antoine. students, have credentialing requirements been relaxed so that students can now work in the hospitals, or was that already the case?
So Fred asked, when I talked about the increase in our staffing through the Center for Nursing website, whether nursing students would be able to work. And through the executive order that was signed, they will be able to work. It depends on where they will be working, whether it'll be in a nursing facility or an assisted living facility or a hospital, to how they'll qualify for that job.
So that's an old executive order.
Yes. And we have talked to a lot of the nursing deans and directors, and they think that the nursing students are excited about this opportunity, especially during their winter recess break.
Any further questions from here in the room? All right, well, seeing none. Governor, do you have any closing remarks you want to make?
Just again, I want to just reiterate my thanks to all of our veterans across the state and what they've done, and wish them all a very happy Veterans Day tomorrow. And then, of course, remind people again about our rules. Avoid the 3 C's, those crowded places, confined spaces, close contacts, about wearing a mask when you go out in public, wash your hands often, keep that 6 foot of distance when you're out in public, have good ventilation, make sure you stay home when you're sick. And please, when you're talking to our contact tracers, whether the ones from the local public health department or from the state, please leave some space for grace. Remember, they've got tough jobs. They are just trying to keep us all healthy. And so please be considerate to them when they're calling, and answer their phone calls so that we can make sure that we talk to people about the importance of quarantining and isolating. With that, Taylor, I'll go ahead and turn it back over to you. Thanks.
All right, well, thank you all for joining us here today, and we'll have our next briefing here at 2 o'clock. And until then, we wish you all happy and healthy Veterans Day.
Great. Thanks, folks.